Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the May 27, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County added 6 new COVID-19 cases today since my report yesterday. As of May 27th, Dubuque County has 329 positive COVID-19 cases. That's a rate of 340 per 100,000 population. No additional deaths were reported, so a total of 16 deaths remain in Dubuque County. 4,954 people have been tested, and about 7% of the cases tested in Dubuque have been positive. 8 individuals are currently hospitalized. 154 people, or about 47% of Dubuque County positive cases, have recovered to date. 802 Dubuque County residents have had serology or antibody testing. 53 of those, or 6%, have tested positive for COVID-19 antibodies. The state added 658 cases since yesterday. So as of May 27, 2020, Iowa has a total of 18,360 positive cases. In all, about 1 in 23 Iowans have been tested, and about 13% of Iowans tested have been positive. 64% of the cases are symptomatic, and another 22% are pending symptoms. 15 additional deaths were reported in the state since yesterday, for a total of 490 Iowans. And 46% of all COVID deaths due to COVID-19 are in those 80 years old and older. Currently, 345 cases are hospitalized in the state. And finally, 9,983, or 54% of Iowans, have recovered to date. So yesterday, Governor Reynolds announced modifications to the current Iowa proclamations. So just a quick review of all those modifications. Effective May 28th, bars, wineries, breweries, distilleries, and other social or fraternal clubs may reopen. Effective June 1st, speedways and racetracks can open to events with spectators. Outdoor performance venues such as amphitheaters and grandstands can hold live performances. Casinos and gaming facilities may reopen, as well as amusement parks, bowling alleys, pool halls, and arcades. And social, community, recreational, leisure, and sports gatherings of more than 10 people will be permitted again. The proclamation also permits practices, games, and competitions for youth and adult baseball and softball, and also individual sports. All of these must occur with the proper social distancing and public health measures in place. So what's left on the closures and restrictions list? Through June 17, 2020, the following must continue to be closed: theaters, including indoor theaters and other indoor performance venues with live performances; senior citizen centers and adult daycare facilities; indoor playgrounds or children's play centers remain closed, and this does not apply to child care facilities and private residences. So with most things opening up, we have to continue to be cognizant of proper social distancing and public health measures in place. What exactly does that mean? It means usually 50% occupancy, both for indoor and outdoor events, physical distancing of at least 6 feet for spacing of employees, patrons, participants, and spectators. Hand washing and hand sanitizing frequently. General sanitation and cleaning of services, and of course, masks. The thing about masks is, whether you use a t-shirt, a purchased mask, or a homemade mask, make sure that it covers your nose and your mouth at all times, and that it's tight-fitted enough so it stays in place. Be prepared for all of these public health measures. You can't always count on the establishment to have everything necessary in place, or have enough sanitizer, sanitation measures, or the ability to enforce all of these things. Also, you can't predict how many people will be in a certain place at once. Therefore, it's important to bring your own mask, hand sanitizer, and have a plan to leave if the situation presents too much risk for you. If you are in a high-risk group for a serious illness, it's your choice whether to go into a public place and do shopping or participate in some events. However, not everyone has the luxury of making that decision. They don't have the ability to say, I'll limit my contact because it's their only choice, through work or because they're the only ones to get the necessities they need. People in our communities also have to deal with all the brain health issues of being isolated and having limited social contact. This also has a big impact on our health in addition to contracting COVID-19. So when venturing out, be prepared. Mask, sanitizer, a plan for doing what's necessary, how you will maintain physical distancing and not straying from your planned outing. In the meantime, let's all continue to be safe, be smart. When in doubt, don't go out, and remember, we're all in this together.